Okay, and then we have Dr. Ketterpaul. He is a cardiologist at MCVI.
Okay.
Yay, MCVI. Liz is over there going, whoop, whoop. I don't see him, but Trevor, oh, there you are, Trevor. Trevor Grice is a clinical psychologist at Liz Psychological Services. If you've ever talked to Trevor, it's like talking to your brother. You just feel like I can tell this guy anything. He's very, it makes you feel comfortable. And so you may be related. He said he's got missing siblings. Okay, then Nikki, of course, our featured speaker and author. Bariatricfoodie.com. I highly recommend you guys all go to her site. You're welcome. Megan Hammes, my partner in crime and RDN, registered dietitian at St. Mary's of Michigan. She's a razor root. Lance Redwans. Lance has too many initials at the end of his name, so just look up there. He's this and that and that and this and everything else in between. But he is here to answer dietary questions and also on the exercise side of things, because sometimes we think, like Nikki, you have to go, she started like walking, but then she kind of got aggressive, and it can become a new addiction. So how to slowly start and move that into your daily life after you really feel amazing and can do it, he's the one to ask for those. And then of course we have Beth Gibbs. And as Beth is walking up here, please remember if you have a question, you're welcome to stand up to where the phone or the microphones are, or we do have your questions. If you could give them to Tammy, we'll make sure to read them. And then Ryan Luft. Okay, so this is our panel, and what we're going to ask you guys this year that's different from last year is if you're asked a question, if you could go up to the mic and speak, but no karaoke, Dr. Pittis, okay? He's not doing it, he said. I really want you guys to take advantage. How many opportunities are you going to have such a panel of experts to ask questions to? So don't be afraid to ask the questions and utilize this expertise. We did a survey, and actually on your tables, we want this at the end so you can get the full effect of it, but Tammy, can you give me one so I can show them? Is a beautifully bright green, lime green, Tammy's favorite color. And who knows Lisa's favorite color? Purple. Thank you. This is the survey, because we want to know, one, did you enjoy the event? If you did, would you recommend the event? What would you like to see in next year? Maybe even a suggestion for a speaker. And if you're interested, those of you who are not at one of our patients now, there's a way for us to get in contact with you. So please fill these out. They are very important. This piece of the presentation was the favorite last year. Everybody loved the panel discussion, and sometimes somebody else will ask a question you didn't even know you thought you wanted to know, and it really is very enlightening. So does anybody have a question that they would like to start with? Okay, you gotta go up to the microphone.
I have teacher voice.
You have a teacher voice? I didn't even see you come in. Okay.
Is there any way to tighten skin without surgery?
Dr. Pittis?
Great question. Tightening the skin actually depends on a few things. Depends on how much weight you've actually lost and the age you were when you actually lost the weight. As you can imagine, the less weight you lose and the younger you are, the more likely your body will recoil because of elastin in the skin. As we get older, and I'm talking over 40, and the more weight you lose, the less likely that skin will recoil. So that's the people that need the abdominoplasty to brachioplasty, the thigh lift, the breast lift. So it's all on a patient individual basis.
Lance, you want to touch that too as far as the exercise piece of it? What you can do, like exercise-wise to help, you know?
Well, I will say this, that there's no real such thing as spot reduction when it comes to exercise. So if you do have a particularly difficult area that you're looking to really lose the weight in, we can't necessarily do that. You're going to lose it as a whole body kind of experience. And you may be genetically predispositioned to start losing in one specific area or not. As for skin tightening, I would recommend initiating some strength training in addition to some cardiovascular training. Normally cardiovascular training, we're looking at about 30 minutes at least 5 times a week. And just for weight loss, we're looking for anywhere about 120 minutes to 150 minutes of overall exercise a day.
Thank you, Lance. I feel like, you know, thank you. Thank you so much. So I'm going to ask you a question. Ryan Luft, how much did you get paid to be on the signs and radio to be here today?
That's a question that I've been asked a lot, especially from coworkers that think I'm getting ready to retire and move to the Bahamas. No, not happening. I received absolutely $0 to do this. You know, I was asked if I was interested in doing it, and you know, I am kind of the volunteer person. I do volunteer as a fireman and do other things to help people, so it was kind of almost a perfect fit for me, because just to give back and kind of help, you know, help everyone understand this better and talk through this process. And it's really helped me too stay on track with continuing on to keep losing weight and stay healthy and stay the course. So I was very fortunate for Lisa and the team to ask me if I was willing to do this. So thank you.
Don't tell Ryan that the others got paid. Just kidding, just kidding. Anybody else have a question? Or I could go ahead and go up to the mic with your pretty purple hair.
It's another plastic surgery question. When you go for your consultation, the first one, do you give, besides like if I say I want to have my stomach done, do you look over and see what else you might be helpful to improve, like your arms or anywhere else? Does that matter?
Sure, we'll definitely consult the entire body, what needs to be done. But the biggest bang for your buck, so to speak, is definitely the abdominoplasty. Another big factor we have to consider is what is your insurance also willing to pay for? Yeah, it depends on the insurance company, but for the most part, I'd say in my experience, about 80% of the companies out there will pay for the abdominoplasty. What happens when you lose the weight is you have a lot of rashes that tend to build up. Skin against skin is never a good idea. So you have rashes that build up, you can sometimes have a mouth odor that also develops. And that, along with, you know, when the skin stretches out, those striae can also become infected. So the insurance companies normally pay for the abdominoplasty. Like I said, about 80%, I've never had a problem with that. But if you've got other problem areas like your thighs, your arms, your breasts, even a lot of patients have, you know, a lot of loose skin under their neck, and they don't like dealing with that. So all those things can be addressed individually, and we can look at them first off when you come in the office. What I normally do is I take pictures of everything that we need to do, and then we basically break it down into what can be done. Sometimes we combine procedures. We can sometimes do abdominoplasty with a breast reduction, and of course if you need that. But you know, we try to maximize the amount of time spent in the OR so you guys don't have to be exposed to a lot of anesthesia. So yeah, the process is very streamlined. You know, everybody in my team knows exactly what they're doing. It's just you kind of show up and everything kind of just unfolds. It's really, really nice.
Thank you, Dr. Pittis. Okay, another question. Well, I guess it's for the group. Does anyone else have regurgitation and spasms daily? I mean, is that normal, Dr. Stalin? Microphone.
And, so it really depends on what kind of surgery we are talking about. For example, something like a lap band, you're probably going to have a lot more vegetation as compared to something that, say, like a gastric bypass. It's just the fact that it's a different kind of surgical procedure. With the sleeve gastrectomy, again, you're going to have potentially a higher risk of regurgitation.